Like everybody says to me, I never realized how much I use my hand until I heard it. Now I'm like, oh my God, I can't do anything. We use our hands a lot. Most people take them for granted. A lot of times people come in and they've been to a couple other doctors, maybe they're specialists, maybe they're not, and nobody can figure out what's going on, and they go on and on. Usually, honestly, when somebody comes in my office, within about 5 seconds, I know what's going on. Last thing you want is to go to someone and they recommend surgery, and you don't know if you really need it or not. I can do an injection. It's sort of like if your mouth hurts and you numb a tooth and the pain goes away, that's a tooth. And when I inject them and they're pain-free, like their eyes light up, like, oh my God. First of all, you know what the problem is, and they know that it can be helped. The most common thing I see is carpal tunnel syndrome, and housewives, but also people that do manual labor, people from all walks of life get it. That's very gratifying to treat because the endoscopic carpal tunnel release takes me 5 or 6 minutes and it's cured. So there's a 2 incision, there's a 1 incision. The 1 incision is what I do. It's actually the least invasive way to treat it, and it gets you back the quickest. They see me, they get a diagnosis, they get treated, and they get to go on with their life. I think people always are a little bit scared about surgery, but I think people with carpal tunnel that get woken up every night, when you can't sleep at night, that is a great incentive to get things done. Just, things we take for granted, opening a door, opening a jar, turning a key, they can't do it because it hurts too much, and they can go and do it now. They can't make a fist because their hand won't close or because it's deformed, and I get them back to doing that. People that want to get back to work, they have to lift things, but their wrist hurts. People that just want to be able to play with their kids and throw a softball with their children, get them back to that.